Each Baby Counts is a national quality improvement programme to reduce the number of babies who die or who are left with severe brain injury as a result of incidences occurring in labour. Every day, 3 children in the UK are born with a preventable HIE. In the UK, each year, over 1,000 babies die or are left with severe brain injury, not because they are born too soon or too small or have a congenital abnormality, but because something has gone wrong during labour. Following data collated across numerous reports, several improvements were identified within the human factors of the care given, such as our communication, listening to our patients, our professionalism, our teamwork, and our compassion. To target the improvements identified, the Escalation Toolkit developed 3 interventions. Identify the need to escalate and how this will be done, communicate the right information to the right people, and act and respond upon a potentially critical situation. The Escalation Toolkit uses 3 simple tools to implement these interventions: Team of the Shift, Think, Aid, Teach or Treat. Using these 3 interventions, the Each Baby Counts Escalation Toolkit aims to help maternity units build the right behaviours, conditions and culture that enables effective clinical escalation. Let's have a closer look at each of these tools now. The Team of the Shift tool aims to introduce a huddle at the start of every shift to make escalation easier so we can continue to keep women and babies safe. It is a simple tool to ensure we know who everybody is on shift today, who are you going to escalate a concern to, do you know how to contact them, have we celebrated our successes, are there any concerns, have we checked if our colleagues are okay, and do we have a shared vision for the shift. It aims to set the scene for the day, identifies the team leaders, and helps everyone have a voice. It creates a psychologically safe environment, encouraging anybody to be able to raise a concern, and helps create a positive work culture with a sense of teamwork and mutual respect. The second tool is how we actually raise that concern. What language are you using, and what response are you expecting from your escalation? Start your conversation with what you need. Think, aid. I need advice, or I need to inform you, or I need you to do, and state what that may be, before you then go on to give your S-bar of information. This can help the person you are escalating to. For example, if you're ringing the consultant at home in the middle of the night, a long descriptive conversation giving information, some of which is not relevant to the issue you are raising, can reduce the clarity of the escalation. By using aid, advice, inform, do, it helps them to prioritise their work more effectively and lets them know immediately what you want from them. The third tool of this kit is Teach or Treat. Teach or Treat is in response to a clinical concern being escalated to you. Frame your response as either teach or treat. Imagine you are responding to an escalation of a concern and attend to review. For example, a review of a CTG. You enter the room, review the trace, sign it, say it's fine, and leave. Is the midwife reassured? Will they feel that they can raise a concern again? How does the woman feel? Is she reassured? Teach or Treat encourages the person who is responding to the escalation to explain their decision-making process. Alternatively, it can be used to explain why you have been escalated to in the first place. If you are happy with the CTG, explain why. Teach. Thank the midwife for escalating and explain when future escalation may be required, or if you want to come back and review the trace, say when you will do this. The escalating midwife feels reassured, as does the woman, and future escalations of concerns are encouraged. However, if immediate action is required, thank the midwife for escalating and treat. Take the appropriate action required. Teach or Treat promotes respectful learning conversations between colleagues during an escalation to respond kindly, quickly, and appropriately. We want to reduce delays in escalation by improving the response and action taken, standardise the use of safety critical language, improve how we listen to the woman in our care, reduce feelings of hierarchy, and create and promote a culture of respect, kindness, and civility amongst staff. Using Each Baby Counts Escalation Toolkit, we can do this. Remember to identify your team of the shift, think, aid to communicate during escalation, and act by teaching or treating.